I came to Logan in 1977, the fall of 1977. I was, I had gone to school in Boston, Massachusetts at Northeastern University, and I had finished there, and I had worked for a while, and there was a recession going on at the time. And so there were not a lot of jobs available really, and I was hoping to kind of work for a little bit before I went to grad school, but jobs were not really available, and so I said, well, I'll just go to graduate school. So I applied. I'm a skier, and so I wanted to go somewhere in the West. I got accepted to Utah State, and I came on out. At that point, Joe Stoachek had just come to Utah State University. He was hired by the center at the time to be one of the division directors, the dissemination division. Joe and Seb Streifel had teamed up to write a grant. They had a project where we were going to look at the inclusion of children with disabilities in preschool settings. They asked me if I wanted to work on it. Kind of the deal we had worked out is we were working with the developmental day schools, which at the time there were some in the valley and there were some around the Ogden area. This was down in kind of near the Air Force Base, where our primary site was. And so I started working on that project. We did that project for 3 years. It turned out to be a big success, really. We were able to integrate children with disabilities into preschool classrooms that were, privately funded programs, not public programs. In all honesty, when we started the project, I was not sure it was going to work. I came here and was interacting with other children with severe disabilities in the classrooms, and I thought, this may or may not work, but I'm willing to give it a try. That's what experimentation's all about. But literally, when we walked into the classrooms, the preschool classrooms, to talk with the teachers, kind of do some planning and that, teachers talked about how they were afraid of children with Down syndrome, how they were really scared, they didn't know what to do with these kids. I mean, it was really amazing. Kind of the level, people were just concerned they didn't really know what to do, that there was something special involved, when in reality, you just have to interact with them like they're kids. That's kind of the basics. So we started the project. We had good success. Kids were integrated fine. In fact, we did an evaluation study where they were doing better than children who were at self-contained centers. We took the information. Joe Stoachek presented to the state legislature. The education committee, a couple of occasions, really kind of helped shift things. And a really good program, we developed a social skills program to kind of help the kids interact more appropriately with other kids. Turned out to be great. We got that published. We were able to do some other work on there. Really kind of this whole idea about working, kind of training people, kids in the moment when they're working on different skills. So instead of, pulling kids to the side and working on numbers or colors or anything like that, we would just have the teachers work with them during the course of the day. This kid needs to work on his colors a little bit. Preschool kids are playing with the colorful stuff all the time. Why not talk about colors then? And so I wrote a grant at that point to kind of look at the transition of the children from the preschool environment into the kindergarten environment, the preschool transition project. And we did that. That was a 3-year project, and I did that. And at the time, really nothing was being done for children with disabilities. So the teachers, essentially, what would happen is they'd be in the preschool environment, and then they'd just show up at the elementary school door, and nobody knew anything about them. The kids with disabilities didn't have any experience. They didn't have any expectations about what was going to happen, how it would look. The people in the receiving environment in the schools, there was still, you were dealing more with special ed teachers at that point, but still really segregated at that point, and there wasn't a good feel for it. And so we really especially worked on kind of looking at kids' academic skills and making sure that the new coming teachers were aware. We had set up visits with the parents to go visit the schools that they were involved in, gave them some ideas about things they could talk about, things they might want to ask about, kind of gave them a chance to kind of make that a little easier, kind of with a focus on, how can. And the other thing that would happen is, we would have, a detailed set of records, because, we still had to identify children as a child with a disability. So we had to go through the testing process, to do that. And basically, the schools would just take our data and just like toss it out. It was like they wouldn't look at it at all. And we worked with them on kind of taking in our data and accepting the data as reliable data, essentially valid, so that they wouldn't have to redo everything all over again. It's a lot of stress for families. The testing process, I think for us who do it, we do it a lot, and it seems straightforward and pretty simple. But for a lot of parents, it's very, very stressful. We're coming up with information, and the way we presented at the time, we were more often telling them about what the problems their children had more than the strengths their children had. I think now we do a much better job at talking about kids' strengths and what they're good at. But really at that point, it was newer, and we really tended to focus too much on the deficits, I think, and that really has changed over the years. So now, you look what's going on now. Now most of the school districts in the state of Utah, they have programs for children with disabilities. They're integrated into preschool classrooms. We have more preschool classrooms for all kids, as a matter of fact, which is a good thing. Kids with disabilities are more readily accepted. We still see sadly, we still see some issues about how children are included in elementary schools, and that continues to be worked on. But it was a time of good progress. There had been kind of a reluctance to do this kind of research with children with disabilities. There are concerns, whenever you're doing an experimental study, that they have varying skill levels, varying developmental skill levels, and they're all in the same classrooms, and different types of disabilities. There were concerns not only about the children, but the fact that we had decided to do this comparative kind of evaluations, looking at kind of what we tried to do really is kind of look what was going on, and that would be our comparison group, and then somehow enhance that in some ways. More days per week, more time, more use of specialists. They kind of varied along those lines, and kind of looking at whether and what makes the difference. Is more better? Is more of like preschool better? Is more intensity if you do it for more times per week? Are those better? It boils down to, in some ways, some of the studies, for example, we found that a few more hours a week wasn't what was making the difference, really. Some of the comparative studies we learned a lot about what was going on with the kids. We kind of could see what was happening. We were following up with what the services they were receiving. But sometimes we weren't seeing much differences in results, which led to a kind of discussion about, do we want to do more time? And again, it goes through this discussion process, and we came up with some set things that seemed to work well for everybody. But I think that issue of what works best for whom is really something that still goes on today. When I first started, services only began for children with disabilities at kindergarten. A little later, our government passed a law that we could serve children ages 3 to 5 once we had enough of this preschool information showing that was helpful for children and families. A little time after that, they finally said, well, you can work with infants and toddlers who have disabilities or identified pathways to disability. But it took years to get to that point. That was in the late 80s we finally said that was okay. And then kind of what happened is kind of the model a lot of people had in their mind is that we would go in and just teach parents what we thought they would need, which really led to some frustration on the part of parents. They're busy people, they're at work. People were coming in and saying, you need to do more of this, more of this, more of this. And we know that if you have a child with a disability, especially a severe disability, your time and daily activities of living just skyrockets. I mean, you don't have a lot of time. That was kind of the approach where now we're it's not totally changed, but let's say the movement in the field is really towards working with families, finding out what they do every day, what works for them, what are they interested in, how do they want to work with their child, what can we do with them, what can we help you do a little more of during your day, your everyday activities, how can we include this in, and we do that, and kind of what we're seeing, I think, pretty broadly is that parents are actually doing a little bit more like that. They're able to fit it into their regimes. They feel better about the entire approach. They feel they have more control over what's going on. So we're seeing some very positive changes. Not everybody's kind of made that change yet, but I really see things are strongly moving in that direction. We had a fellow working on our team who was at the University of Utah, was an expert in kind of environmental air studies. We have data on people's homes, what they were like, what kind of pollutants they were exposed to early on. Other projects do too, and looking at kind of the impacts of that on kids later on down the road. Other kinds of behaviors in that played out. Things that lead potentially to autism. So that's kind of big. We ended up with the National Children's Study, which was a national study looking at. We actually have data here in Cache Valley on on families when they were just thinking about having a baby. So kind of some of the precursor things, we were able to follow people's pregnancy. We got a lot of data around pregnancy for lots of folks. We had about a couple thousand people in the Valley enrolled in the research. We actually had more people enrolled in our site here at Utah State University than any other site in the country. And in fact, between us, and we were working with the University of Utah on this, Utah had the most families in the study by a long shot. In fact, almost 25% of the sample was Utah people, which makes us look good, but it's bad for research, really. You want it to be a little more distributed. But that was a big study. I started working with the Granite School District in, it's a long time ago now, probably early 2000s. Brenda Van Gorder was, she had been the state director for the 619 program, which is preschool special education. She moved into a position in the Granite School District as a coordinator of early childhood service or director of early childhood services, something like that. Her job was really to kind of start preschool in the Granite School District. Granite School District is kind of unique in that there's a majority poor, majority not ethnically diverse school district. They really were, she was aware of the research that preschool can help kids get a jump start into kindergarten, into school, help them do better. I started working with her on some evaluation research. I was written into the grant to kind of do that. We started working, we followed, we looked at what was going on. We were constrained a little bit by what the proposal, the grant proposal required that we do. So the way the feds had set it up. So we were doing that, but so we were evaluating, again, kind of what I would call what was currently occurring if it was a preschool program versus an improved version. Not quite a Cadillac, but better than the old rusty Ford, let's say that. So we really looked at that, and we saw significantly better results in the kids that were in the better program. So we really looked at that and kind of what was going on with that, and we presented some of that to the Education Committee at the legislature to kind of let them know about what was going on with that as well. We were, the Kellogg Foundation got really interested in our findings, and they funded us to do more. They wanted to see if we could also help, not just a program that was run in a school district, but a program that was a privately funded program. So we worked with some programs that were, they paid their own way. Some were part of like the YMCA and things like that. So we had another 3-year project where we really looked at kind of, can we take what we did in the preschool environment and put it into in this classroom, that's Granite School District preschool environment, and put it in these other programs and make it work. The data, again, suggested it did, and again, we presented some data we were really pushing the legislative committee a little bit to kind of think about preschool as an option. And then at some point, we had these data, and then somebody who worked at Voices for Utah Children at the time, Janice Dubno, gave me a call out of the blue, basically, and she wanted to talk to me. And Janice had recently come to the state of Utah. She had worked in Wall Street on bond development. She had this idea for what she called a preschool bond. And so it was interesting. I had done cost evaluations in the past, and so I was familiar with some of the methodology to do cost kind of studies. Her approach was really kind of a different, blew my mind away really, and then we involved Brenda Van Gorder as well in these, and really came up with this what we call now social impact bonds or pay for success, which was really both the Voices for Utah Children and the United Way of Salt Lake got involved. They really helped lobby businesses, the business community, to make them aware of the data and this idea that if you could invest in preschool, you could pay for this investment. There was a way to kind of you could recoup your investment and the way we structured it was the design was really kind of with the children that were going, many of these children were scoring extremely low on standardized tests, which was not good. Those kind of scores predicted special ed placement later on in school. that if we were able to intervene, kind of improve their skills, we could reduce special education placement later on. Special ed placement is an expensive commodity. So we worked out a system, well, Janice worked out this bond where for every year these children stayed out of special education, there would be a kickback of fund, not really a kickback, they would be paid back on their investment with a certain amount of money. There were limits on how much businesses could make, but we were able to get the, I'm blocking on the guy's name for a second here, the Pritzker Foundation involved. Pritzker is now the governor of Illinois. He's done tons for the architectural world. Got his foundation involved in the whole process. We got the big bank, one of the big banks, I'm blocking on the name, one of the big banks involved as well. They were willing to put up money. So we were able to kind of structure a bond, but the business folks wanted it to be backed up by the state of Utah. So there was a lot of lobbying that went on to try and get this so that the legislature, the Utah legislature would back the bond. Didn't happen in the first year, it did in the second year. We lobbied for it. We funded 6 years of preschool for kids, for thousands of kids basically. We funded a preschool for these kids that wouldn't have been able to go to preschool otherwise. Now we're, the first cohort has just recently, we're following them through 6th grade. The first cohort just recently got it through 6th grade. The second cohort just this past year was in 6th grade. We'll follow 5 cohorts up through 6th grade. So far it's worked out great. And one of the things that happened really as part of this...
Still running then?
Let's say the longitudinal data collection is still running.
Okay.
So, but what's happened at the state level is all of a sudden, all these business people are involved and the legislature's thinking about preschool for kids. And all of a sudden, they start some of the folks in legislature, especially those that had some education background, started saying, well, we should do this for all kids in Utah. So this kind of helped. So again, we met with the education committee of the legislature a few times, and this kind of spurred this whole thing where now the state has really stepped in. Now they're requiring that we have preschool programs across the state. They're helping fund these programs for kids. They're trying to make sure that they have some quality behind them. They're trying to make sure they're fair. They're providing training to people in different, both, urban and more rural counties to get preschool programs in place. So although the study itself didn't have this direct effect, we're not doing the pay for success bonds anymore, but the effect was really it helped impact what was going on in the state. Lots of things impact what's going on at a system level like that. I think it helped lead to quicker implementation of preschool for kids in Utah. And this is primarily aimed at at-risk kids, but which by definition in our country is typically low-income kids. Low-income kids, ethnically diverse. But it's had an impact of making those services more available now. And I think in the big picture, it really had an impact on families in Utah in general. One of the things we did a lot of work in the home visiting field, both disability focused and children at risk, as we say in our country. And in some ways that has had, I went into kind of measurement development with some of my colleagues, Lori Rogman in particular, and we developed a measure for looking at parent-child interaction, a tool whose nickname is Piccolo, Parenting Interactions with Children Checklist of Observation Linked to Outcomes. That's why it's called Piccolo. And we started talking about that and getting programs interested. We have widespread use in the United States now. We have a version that just was published. We have a Turkish version that's been published. We have a Spanish version that's being published. We have an Italian version that's in press. We have a German version that's just recently published as well. We have translations, all over the place now. People are using this instrument everywhere, which is great. And then we also developed this one, the Home Visit Rating Scale, which is a way of looking at the behavior of the people that are interacting with the families. So when you go into a home, kind of, what are you doing? Kind of, what's your behaviors? And we really look at the things we kind of look at is kind of relationship development. How do you develop your relationship with families? Are you responsive to the family and the family's needs? Are you facilitating that parent-child interaction? Are you collaborating with them as equals? And then we also look at some engagement characteristics. But it's turned out to be a pretty, we don't have as much psychometric support. We have pretty good psychometric support, so it's got enough validity, better than a lot of these kinds of measures, I'll say that. And so we've got some psychometric validity, and people are really using this pretty widespread. Again, here in the US, it's being used pretty widely, and more and more overseas as well. We work with we worked with the programs in Chile and Uruguay that are using it. Some programs in Brazil have been using it. Programs in Ecuador. There's still some research going on with Lisa Boyce and Eduardo Ortiz, who's here at the center. That they're still working with folks in Ecuador on kind of collecting piccolo data down there. So that's good. So the kind of home visiting tools have been well received. That's been nice.